Hello, I'm Cindy Arenberg Seltzer, President and CEO of the Children's Services Council of Broward County. Welcome to another edition of Future First, Focus on Broward's Children. According to the National Cancer Institute, cancer is the leading cause of death by disease in children and adolescents in the United States. The Center for Disease Control and Children's Oncology Group report that each year 13,500 children and adolescents 18 and under are diagnosed with cancer. Because of the difficulty in calibrating treatment for children, the remedy can often be as lethal as the disease itself. Because of its prevalence, it's also likely that a child will have a loved one or someone close to them affected by cancer, and it's important to provide accurate and age-appropriate cancer education to Broward County children and their families. That's why we will also be talking about the Kids Can program developed by Gilda's Club. Here today to talk to us about this issue are Beth-Ann Krimsky, President of I Care, I Cure Childhood Cancer Foundation, Marianne Watson, a Community Coordinator for the Patient Family Education Support Network of Broward, Shelley Goren, President CEO of Gilda's Club of South Florida, and Dr. Lynn Meister, Pediatric Hematologist, Oncologist, and Medical Director of the Pediatric Palliative Care Program at Joe DiMaggio Children's Hospital. Later we'll hear from Meagan Roloff, who manages the children's program at Gilda's Club. Doctor, I want to start with you because those statistics are shocking. I can't believe how many children are being afflicted with cancer.
Right. And the latest statistics just actually were published last month that showed that actually in 2014, 15,780 children between the ages of birth and 19 years will be diagnosed with cancer. Wow. So it's a big number, but thankfully 80% of those children will be cured. So our success rates are excellent, yes.
What are we seeing as the most prevalent of those?
The most common cancer in children is leukemia. And of some leukemias, 90%, 95% are curable of certain types of leukemia. So our success rates are good. Second most common cancer in children are brain tumors. Not as curable, but some have good success rates, others not so much at this point. But our cure rates do come with morbidity. There are significant side effects from the treatment of childhood cancer. So that's something that with our treatments we're working on. We at Joe DiMaggio Children's Hospital are members of the National Children's Oncology Group, and we use standardized protocols that are used across the country to treat children with cancer. But our treatments are still very aggressive, which is why we have such good cure rates. But we do have patients who have significant long-term side effects that we're trying to diminish these long-term side effects, but not lose our good cure rates.
And Beth-Ann, that's where you come in, right?
Yes, I Care Childhood Cancer Foundation was actually founded by parents Beth and Brad Besner, who lost their son Ian at age 11. He had gone into remission about 15 days after being diagnosed, yet he passed away 4 to 5 months later, in essence, from the side effects from the very toxic chemotherapy. And in essence, when you're in that situation, of course, you're going to try to do everything you can possibly do to cure the cancer. And so our mission is really to find less toxic targeted chemotherapy so we can give doctors, like Dr. Meister exactly, more options to help treat these children and try to minimize the side effects so that the cure is not actually what ends up resulting in the morbidity that Dr. Meister discussed. So we raise money throughout our community and only fund the specific type of research to try to find better cures for childhood cancer.
Is that happening only in South Florida, the research? Or
No. It's actually happening throughout the country. We actually are about to announce a research project in South Florida. Give me a month or so and I'll let you know about it. But we are actually trying to fund whatever our scientific review committee finds to be the best research that's most likely to lead to promising results in that specific area so we can help try to find more targeted therapies for pediatric cancer.
And you hear about that all the time, not so much with cancer, but that the cures or the medications are tested on adults and often adult men, and then we give them to women or to children and think, oh, just a smaller dose.
Well, it's interesting. There are a few different types of statistics out there, but the amount of government funding for pediatric cancer research is probably in the 4 to 5% range, which is far less than most adult cancer research. And you can understand it because there's more prevalence. But when you have a child who is diagnosed, you sort of just expect there to be good treatment options available. And that's really what our foundation is about, is trying to help push that envelope to get more funding for that type of research, so no other parent has to deal with what the Besners did.
And when you're in that situation, and as I mentioned to you earlier, this is personal for me, not with a child, but I myself am a survivor, and I know that when the doctor came in and said, the thing we need to do is chemotherapy, I said, okay. He said, well, it used to be that you needed 8 rounds of chemo, and then they went down to 6, and now it's only 3. Yay, lucky me. But, you need 3 rounds of chemo, and we need to start Friday. And it was going to save my life. I said yes. I didn't do research into what is that chemo, what's the dosage, what's that going to mean to me. So when it's your child, I can only think that's going to be an even more of a knee-jerk reaction. Give it to my child.
Well, Dr. Meister, how often do you start chemo the next day sometimes?
We usually have to start the next day, and most children, sometimes we have a few days leeway, and families can go out and do their research. And as we had talked about, the internet is not the best place to go because there could be any kind of information out there. So you have to do good research if you're going to. But there's not a lot of time in these situations, and we hope that families will trust their doctors. As I said, the fact that we are part of this national group, the Children's Oncology Group, means that our treatment for most diseases is fairly standard. So they'll be treated the same in South Florida as they will in New York or Boston or most other institutions.
And Shelley,
We have found at Gilda's Club South Florida that an integral part of that treatment is, yes, to do the research and to go on the internet and speak to your doctors, but also to get that peer-to-peer support that you would get from families who are going through the same thing. And we have found that in our groups, that the wealth of experience and knowledge that's passed from one family to the next is just invaluable. And so at Gilda's Club, we offer free support for anybody who's affected by a cancer diagnosis, whether it's a child or a parent, because it affects the whole family for the whole journey, and we're there for that. And that was actually recently studied by the Institute of Medicine, and in fact put in print that the social and emotional support is equal to the medical care that a person receives while they're going through cancer treatment.
and you're going out into the schools now, right?
Yes, we are. And it's wonderful. I'm so excited to be a part of this. I've been an oncology nurse for 30 years, and a great part of treating someone is making sure that they are comfortable. When they first get a diagnosis, there's, as you very well know, there's great fear, and you want to do everything possible. But you also, as you move along through your treatment, you want to make sure that you're getting exactly what you're supposed to be getting, and that you want to make sure that your doctor is the doctor that you want. And I'm so excited that there are so many beautiful programs out there now, giving the education that people need, giving the support that they need. And now that we're moving into a wonderful place with kids, that we can assist them in taking away some of the myths, some of the fears, and giving them some support. It's unfortunate, but in Western culture, there's a great stigma that comes along with cancer. There's a lot of uncomfortableness when people are talking to someone that's been diagnosed, especially a young child. It's a devastation. And it's very hard for a lot of people to even try to carry on a conversation with the parents or the family, and even the family themselves. The whole family changes, it shifts around the disease process. So with education, knowledge is power.
It's not that long ago you couldn't even say, you'd say the C word or they had cancer.
Yes.
You know, you wouldn't really say it out loud. I think that's a good time to hear from Meagan about some of the work going on at Gilda's Club to help children. Mm-hmm. So let's hear from her now.
My name is Meagan Roloff. I'm the program manager here at Gilda's Club South Florida, and I run the children's programs. Gilda's Club is a nonprofit organization. We provide support services, educational services, and social connections for men, women, children, anyone touched by cancer, and their families. Gilda's Club South Florida has always had a pediatric component, has always had a Noogie Land program, but this is our first time going into the community. We've found that there are a lot more kids that are being affected than the ones that are coming here. So rather than hoping for everyone to find their way to us, we're going to them. We have a weekly support group for children with cancer or children of adult patients. We also sometimes get children that are dealing with bereavement issues in that group. We also have our Super Saturday program, which is for any family affected by cancer. There's a group for the parents, a group for the kids, and then everyone comes together to socialize and have some lunch. We also have our new program, the Kids Can Cancer Awareness Now program, which is an educational program we have in the community. Kids Can is our first community program. For the children's programs. We partnered with an oncology nurse to go into middle schools and high schools to provide honest, accurate cancer information. There's so much bad information out there. The internet has, anybody can put anything up and make it look legitimate. So we're trying to get kids when they're young, give them the honest, accurate information they need. The American Cancer Society says that 1 in 2 men and 1 in 3 women will get cancer in their lifetime. So this is definitely something that is affecting kids. So we want them to have honest, accurate information now so that they have a framework for when at some point in their lives they encounter a loved one with cancer or potentially have a diagnosis themselves. Initially, we were going into after-school programs. We were working with the Children's Services Council, and they got us connected with many of their after-school programs, and we've had great success there. Since then, we've also been approved by the Broward County Schools Superintendent Screening Committee to go into the school day. So we're starting to approach principals about going into the school day, talking to health classes, biology classes, peer counseling groups about this education. Since we started the Kids Can program in February, we've reached over 100 students at 4 after-school programs. Over 50% of the students participating have a loved one with cancer, so it's definitely a relevant topic to these kids. Moreover, they're learning. 93% of the kids in the program reported that they learned some to a lot, and on the post-test we give them, the average score is 85%. So they're definitely taking in information. One of the great things about this program and working with an oncology nurse is that they can get those nitty-gritty medical questions answered. So it's not just a lecture. They're asking questions, they're answering our questions, seeing what they already know. So it's very interactive, and I think that's part of why we're seeing such good outcomes.